her leaving, she's supposed to be writing down questions.
Well, good morning. Welcome to Know and Go Friday. Thanks for being here on a little rainy Friday morning, but it promises to get better. I'm Holly Brenner, Vice President of Strategic Development and Marketing for our system, and I appreciate that you're making time for this session this morning. I think it's going to be a great, very informative session from our two new chiropractors. So before we get too far, I would like to share a reflection, and this one is called, What's Prettier Than Freckles? An elderly woman with her little grandson, whose face was sprinkled with bright freckles, spent the day at the zoo. Lots of children were waiting in line to get their cheeks painted by a local artist who was decorating them with tiger paws. "You've got so many freckles, there's no place to paint," a girl in the line said to the little guy. Embarrassed, he dropped his head. His grandmother knelt down next to him and said, "I love your freckles. When I was a little girl, I always wanted freckles." Then she said while tracing her finger across his cheek, "Freckles are beautiful." The boy looked up. "Really?" "Of course," said the grandmother. "Why, just name me one thing that's prettier than freckles." The little boy thought for a moment, peered intensely into his grandmother's face, and softly whispered, "Wrinkles." So maybe our plastic surgeon and dermatologist wouldn't appreciate that, but I found it to be pretty cute. A couple of housekeeping things. We do have our associates with us in Ripon and Waupun this morning. They're on the feed. And there are a number of things on your table that I would like to point out. There are two pieces that are information on our chiropractic care. One that actually, the small sheet, as of today, our chiropractors are moving to their new location, so the new address is on the back of the sheet. They will be in Health Plaza Building B, that's over on Camelot Drive, next to the health shop and dialysis services. There's also a nerve chart, which I think, are you referencing this today? A nerve chart. And then there's a slip for Know and Go Friday next month, which will be interesting. Dr. Colmenares will lead a conversation on our spiritual care services. And finally, we have the yellow and green sheets that you're also familiar with. Yellow comment cards, please fill those out. We really appreciate your feedback, and we take it into consideration for every session. In fact, the temperature feels pretty good in here this morning, something we always hear. And the green slips, if you're interested in receiving credit for being here, and if you're interested in the opportunity to, or the chance to win some Produce with a Purpose gift certificates, we'll be giving out 3 of those today. But just as a reminder, our Produce with a Purpose truck is here on this campus on Wednesdays, and over at Health Plaza A on Fridays from 11:30 to 1. So with that, I'll introduce our providers. We have Dr. Henson here is a Fond du Lac native, completed his undergraduate studies in biology at the University of Wisconsin at Madison. He pursued his chiropractic degree at Logan College of Chiropractic in St. Louis, Missouri. He also obtained a master's degree in sports science and rehabilitation. And Dr. Judkins was, as I just learned, born and raised in Green Bay. That means up to 7th grade. And then he came to Fond du Lac, and he was a Sabish Bear. So that means something to me. He is a Fond du Lac native. Then he completed his undergraduate studies in biology at the University of Wisconsin at La Crosse and pursued a chiropractic degree at Northwestern Health Sciences University in Bloomington, Minnesota. So both of these providers joined our team in March of this year, and as I mentioned, they're relocating today. Actually, I think they're kind of skipping out of a move right now, aren't you? All right, so we'll start. Dr. Judkins will be starting us off. Thanks.
Hello, my name is obviously Andrew Judkins. Everybody can hear all right? I don't think I need a microphone. So we're just going to give a little introduction about ourselves, and then we'll kind of get into the meat of our presentation. When I was growing up here in Fond du Lac, I knew when I went to not to chiropractic school, but to college, that I wanted to pursue something in a health-related field. I knew nothing about chiropractic. So when I started at La Crosse, I was headed towards PT, medical school. I didn't really know. That summer, a dumb 19-year-old, I came home, was painting. I painted a chiropractor's house, and I got to know this Dr. Lyncher down in Beaver Dam. I basically got to know him through painting, but what he did, he kind of told me, he's like, "Well, you look like you have some back problems." I'm like, I'm 19 years old. I don't feel like I have too much issues. I'm stiff from being on a ladder all day. But what happened is he took me into his clinic. He adjusted me, didn't explain anything to me at all. I walked out of there, and it was a new experience, but I couldn't describe how well I felt, and I didn't understand why. So I followed up on that because I really wanted to understand, why he did it, and so I actually got to follow him for a couple days, and the whole patient experience was just different than what I was used to. Basically, they were talking about nutrition, there was adjusting. As you'll probably, if you get to know me, I have a hard time not talking. I was supposed to stand in the corner and not say anything. Well, the first patient came in with headaches, and she said, "Well, my headaches are gone." And I think I interrupted Dr. Lyncher, actually, and I said, "Well, where'd they go?" I I couldn't understand why. So the whole thing just kind of blew me away. After that, I decided, okay, I think this is something I want to pursue. Obviously went through the schooling that was mentioned, and that's kind of how I got into chiropractic. But following him around, like I said, it was just a very big difference for me, because it was a different way of looking at health. And we will get into that, but that's what kind of got me into chiropractic. Ended up coming out of school, moved to Appleton for a year, did an associate there, and then wanted to do my own practice, came back home to Fond du Lac, and I've been there on Fond du Lac Avenue now for 10 years in small practice. So when the opportunity came up to join Agnesian, I was very excited. We offer something that obviously is what we do is different than most other specialties, but I'm excited about being part of something bigger. And yes, we can help a lot of people, but we definitely can't cure everything in the world. So being able to work directly with physical therapy, orthopedics, pain management, more of a 5 brains are better than one setting is very exciting. And that's the biggest thing that I'm excited about. Plus our new space is unbelievable. We were just in it yesterday and it's amazing. So I'll let Dr. Henslin introduce himself and then we'll get into some slides.
As Holly and Dr. Judkins has said, I'm Dr. Brian Henslin, born and raised in Fond du Lac here. And same thing kind of with Dr. Judkins. I didn't really have a history of going to a chiropractor. My folks had gone for years, my mom for scoliosis. And I started school in Madison and started doing some research. Couldn't see myself doing that the rest of my life. So, I started looking at some other avenues. My folks had recommended, why don't you go and shadow a chiropractor? And, a similar thing. I had no idea really what they had done, what they treated, and it was just kind of this eye-opening experience that you got people coming in a lot of pain, having problems with even just walking in the clinic, and they're walking out smiling, and you kind of wonder, what the heck did they just do to get these people, feeling that way? So, I thought, well, this is, I'm a hands-on type of person. I think that'd be a good career path for me, and I went down to St. Louis for schooling. And it was really kind of eye-opening. You see a lot of individuals coming in to the program out of families that our parents are chiropractors or have this really cool success story, athletics or something like that, where a chiropractor was really that one avenue that helped them get over a crutch. So it was a really kind of rewarding experience to get started. When I graduated, I decided to come back to Wisconsin and moved up to Eau Claire, practiced at a multidisciplinary practice for a while. We had some PTs, acupuncture, an MD at our clinic. And, since I'm from this area, I kind of thought, well, after a couple of years there, it'd be nice to come back here and start up a practice. And now having the opportunity to join Agnesian, as Dr. Judkins had said, is really cool. I think we're really both excited to be able to collaborate and kind of, complete that circle of care with the type of patients that we treat. So.
All right, so we'll get into education. So how many here have had chiropractic? Can we have a raise of hands? So a good majority of you. How many of you that have been treated feel like you really understand what we do and why we do it? That's a huge difference. And I truly think, like, in public, if somebody comes up and says, oh, you're a chiropractor, either one, they don't talk because they're like, oh, he's a chiropractor, or two, they have a million questions. And I think one thing that myself and Dr. Henslin do a great job with, if you've been to no chiropractor before or you've been to 20 different ones, we really want you to understand what we do and why we do it. And that's partly what we're going to get in today. But I didn't count how many have had chiropractic, but like 2 or 3 kind of understood it, So there's obviously a method to what we do, and we're going to kind of get into that today. There is Daniel David Palmer. He is the founder recognized as the founder of chiropractic. Palmer College, it's in Davenport, Iowa, is kind of the hub for chiropractic schools. Dr. Henslin went to Logan, I went to Northwestern. There's, I think, 14-ish colleges around the country, but it all kind of started down in Iowa. He had his basis, kind of his background, this is like late 1800s, we're talking, in magnetic healing, focusing on more of how the body can heal as opposed to introducing something else to make it heal. And his findings kind of go along with osteopathy, if you're not familiar with that. That came a little bit before, but they're similar but a little bit different. We focused more on the structure of the spine and how it worked. And obviously he started what we now know today as chiropractic. Well, he had a friend named Harvey Lillard, simple looking guy, a deaf janitor. But as the story goes, and I'm not sure how stuff gets embellished over time, David D. Palmer found that there was dysfunction in upper spine. He was into how the spine worked and I'm not sure if he exactly knew exactly what he was adjusting, but as the story goes, he made a manipulation, hearing came back in his friend Harvey Lillard. Now, in 12 years of practice, I have not brought somebody's hearing back. Maybe he was just way better at it than I am. But it kind of taps into how abnormal structure can create abnormal function. So by restoring normal function, okay, and we'll get into this, but a lot of times people think about chiropractor and back pain. That's what we do. We just adjust backs all day. But when we affect nerves, we can affect everything in the body. So if we look at around the C2 level, which innervates ear, there's a plausibility, okay, there could be some kind of ear trouble. Now, deafness seems pretty extreme to me, but that's the story. So we're going to stick with that. So what is chiropractic? And you can read here. It's basically how the spine affects the central nervous system. And what we mean by central nervous system is brain, from your bottom of your brain down your spinal cord. And as it exits, obviously nerves exit at each level. So there's 7 segments in your cervical spine, 12 in your thoracic spine, 5 in your lumbar spine, and then down into your pelvis. Those are all housed and protected by the spine. And we emphasize the recuperative power of the nervous system. So the nervous system itself controls everything in the body. Pain's a big one, but digestion, immune response, everything. So if there's abnormal function in the nervous system, therefore you could have altered function. So this is why we focus on the spine. So doctors of chiropractic, we get a DC. That's why you see it behind our name. We're truly a doctor of chiropractic. So you can see all the classes that we get. If somebody comes into our office and it's a 35-year-old male with symptomatic low back pain, it could be prostate cancer. That's the simple fact. So it's our job to diagnose correctly, make sure that what we're doing can help them, and if not, get them to the right person. And that's why we get a lot of, obviously, the anatomy, physiologies, same things that doctors get. We also get a lot of hands-on. If you look at what we do for a living as far as adjusting, and you can see the 500 hours and it's interning, our last 2 years of school were, myself, for example, I was at the school for a trimester, then I was in downtown St. Paul at a clinic, and then I was at a clinic out in Plymouth with doctors supervising us as we were adjusting. So, and I remember starting chiropractic school thinking I was never going to figure this out, the actual adjusting. It's a skill, and it's like anything else. As you do something more, you get better at it. And by the end of school, it becomes kind of I assess a spine, I can find what's wrong with it like that, and it's kind of becomes second nature because we get a lot of training in it. And I think we're going on to you. I can talk for days, so we're going to let Dr.
So as Andrew has said, we have a lot of extensive exposure to the anatomy of the body. We have a full year of gross anatomy where we completely dissect a cadaver. And we have to really rely on our palpatory skills to figure out where anatomy is, where landmarks are. So it's really important of knowing not only where you're palpating on the skeletal system, but also what kind of muscular tissues you're dealing with, because it's all tied together. And we'll get into the subluxation and misalignment of the spine. But with that effect, you're also not only affecting movement and structure of the skeletal system, but subsequent changes to the soft tissues and then neurological system, obviously, on top of that. So, as Dr. Judkins has said, our primary focus is to kind of restore normal function to the anatomy of the body, specifically around the spinal cord, to affect proper function of the nervous system. That controls every organ and muscle and tissue in the body. So, if there is subtle dysfunction, it can cause a whole slew of different types of health problems for individuals. So, what is subluxation? That's primarily what we treat when it comes to the spine. Basically, what we know as subluxation is somewhat of a partial dislocation of the joint. It's a lack of movement and subsequent dysfunction on a biomechanical side. So if we look at the spine here, you can kind of see that the whole vertebral structure is made up of this really flexible structure. Your spine can move in every possible plane. And with that, you have a lot of things that can kind of go wrong. So what most people don't realize is that, our bodies are kind of a map for what we do to it over life. All the injuries we sustained, a lot of that stuff doesn't naturally just kind of go away. We'll carry with us a lot of the structural deficits and compensate. And it's really until your body can't compensate anymore that you start to hit a wall and experience things like pain, tendinitis, kind of chronic sprain strains. And it's all because, like I said, your body can kind of compensate and function through that until you can't function anymore. So typically what kind of happens with the spine, especially down in the pelvis here, because this is our center of gravity, the spine's going to kind of move in this rocking fashion as you're walking. So if you think about some of the repetitive things that we do throughout life, so for example, I'm a soccer player, I'm always kicking with my right leg. Well, because of that repetitive stress on the right side, what ends up happening is we develop kind of an abnormal positioning of, say, the pelvis. What that does, because this is our gravitational foundation for the rest of the spine, is it causes your spine to start to shift. Well, the problem with that is our head always wants to be level, our eyes always want to be level, so then things want to kind of come back. And you may not have any pain, you may not even know that you've got some of these structural things until maybe your teen years when you've got scoliosis and you see some of these structural problems. And what we are basically do is through our diagnostic testing, motioning the spine, checking out where you're having pain, is finding out where you guys are having these subluxations, or essentially misalignments of the normal anatomy of the spine. So what kind of happened is, like I said, in the pelvis you can kind of have a torquing going on, there's different types of presentations, and up into the lumbar spine and thoracic spine, these vertebrae, like I said, they have a lot of mobility to them, and with that they can get kind of caught up in some different fashions. So maybe because you sleep on a certain side, right up into this area of your spine, you have a couple of these vertebrae that'll kind of shift over, and like I said, your body always wants to kind of compensate to balance itself out. So maybe a couple segments up from that, your spine kind of comes back a little bit. With that, we usually find that there's some restricted motion with it, and those are kind of what's known as subluxations of the spine. And what that does is ultimately affects normal movement function, as well as, more importantly, the function of these nerves, because you've only got so much space for each one of these peripheral nerves to be coming out of the spine. When you start affecting how that normally is stacked up, you really kind of close down on that tissue. Now, it doesn't always pinch off the nerve, but what it does is it creates a lot of irritation around that sheath where it comes through. And so by kind of adjusting it, manipulating the spine, we essentially restore normal motion, decrease inflammation, decrease pain. Muscles usually respond by becoming less hypertonic, and ultimately, a lot of the symptoms and things you have going along with this dysfunction end up being corrected. So, as I kind of explained to you, if you kind of see this as the normal stacking of your spine, and when you have some of these subluxations, in real severe cases with arthritis and whatnot, you can actually get some encroachment where it pinches off this nerve, and you'll start to have tingling, numbness maybe in one certain area of your hand or arm or legs, different areas of your body. Because as Dr. Judkins has said, these nerves service essentially everything in the body. And on that, what we use as a big part of our diagnosis is dermatomes. Especially when a patient comes in, hey, I've had numbness every morning down into the lower part of my arm and the thumb, or different areas. That really gives us kind of a tool to say, all right, what areas of your spine might be not functioning the best based on what you're kind of presenting with. Now, there's a lot of things that can cause numbness and different things like that. But that's just a real good diagnostic tool for us to find out, in addition to our motioning and palpatory findings, where some issues might be going on. And that also being said, when people do have some of those things going on with numbness and feeling things in different areas of the extremities, it's really because we're kind of mapped out in this fashion from the spine. You actually have areas of your skin that are innervated by each level of the spine. And it also, as Dr. Judkins had also mentioned, these nerves, they service all the organs of our body too. That's, we've kind of been pushed into an arena of musculoskeletal, but we also can essentially affect organ function. It's not uncommon for us to have patients come in with heartburn, and they won't even tell you that they have heartburn. Maybe something you cover on your review of systems. You just, you start motioning them, you figure out, wow, you're really caught up, into this mid to lower thoracic area. You adjust them a couple times, and a lot of times they'll come back and say, hey, I haven't had heartburn in a couple weeks. I haven't changed anything. The only thing I've been doing is getting regular adjustments. And it's because you essentially take that irritation off of the nervous tissue, servicing those organs, and they can ultimately restore normal nerve function to those organs. So.
All right, so we get into, okay, what can cause subluxation? Big fancy word, right? Well, the obvious one, physical. I mean, slip, falls, accidents, any kind of trauma to soft tissue and or to spine can obviously cause any kind of subluxation. You know, another one that people kind of overlook is, you know, stress in general. If you see people in a stressed posture, shoulders are elevated, they don't even know it, they're stressed out. And a lot of that, what I see in practice is, you know, tension between shoulder blades, neck, headaches. Well, all the muscles that, let's say you're elevated, you have your shoulders constantly elevated because you're stressed out. All those muscles come from your shoulder blades, go up into your lower neck, into your spine, attach all the way up to the bottom of your skull. So if you have chronic tightness there, it's going to start to create abnormal function in spine. So that's how stress can relate to physical symptoms. And you know, we can't put stress in a jar and measure it. But I've also realized in 10 years of practice, some people you can give stress and it doesn't affect them as much. Other people you give to them and it just stresses them out. And they come in and you can see. So some of the stuff that we do, yeah, we get into adjusting and we want people to feel better. But then sometimes you have to get after some of that stress. And how do we fight stress? We all deal with it differently, but sometimes you have to get into that. Chemical is another one that, you know, a lot of times if we're getting into adjusting and people aren't responding like we think they should, they say, okay, why didn't this work like the last time? Well, then if you look at inflammation in general, and you can see some of the things that can affect that, diet's a big one. If you have a inflammatory diet and we're trying to adjust and get inflammation out of your body, you're not helping us out. So we get into some diet. That's why we get a lot into nutrition. At the Health Shop, we have some nutritional supplements coming, which are very high quality stuff. So yeah, we want to get into restoring function, but the physical is probably the stuff that we see the most because it's the most obvious. I think under physical, this repetitive motions one is the one that we see all day. A lot of times people say, I bent down to shave my legs and I couldn't get up. Why? And they think it was the shaving the legs that did it. No, it was probably the 6 to 8 hours a day that you sit in a chair all, because that's your profession. And let's say that these bones down here, they kind of swing back and forth. They're stuck in flexion all day. You go to get up, it doesn't work as well. And then instead of going home and doing some activity, what we do, we go and we sit and watch TV, right? So then one day when we go to bed and shave our legs, it doesn't work anymore. So the repetitive motion thing, I think, is something, I mean, there's some obvious ones. You know, I talk on the phone like this all day. Why is my right arm numb? You know, those are easy ones. But we get into a lot of that stuff and we start to say, okay, maybe we should switch some things to kind of help us out. So chiropractic, obviously the adjustments, we find the segments that are working right and we apply what's called a high velocity, low amplitude thrust. What does that mean? That means high velocity. We're trained to be quick. And if I've learned anything in adjusting, the quicker you are, the better you are. And a lot of people think adjusting is all force. That's not right. Actually, it's a very low amplitude, meaning it's a very small space. We don't have to move it very much. So a lot of our schooling is obviously identifying where we need to adjust, but then practicing speed. You know, we had this little thing in our, I lived with 4 other guys in chiropractic school, and it was kind of a thing that we used for speed, because the quicker you are, the easier it is to adjust. So a lot of times people think it's, and we'll get into some common questions, but that's how we identify, and with that quick thrust adjustment, we restore function to that joint. So I thought, well, you guys, if you've never been treated, you don't know what it looks like. So I thought I would just throw some pictures in. There's a couple different ways you can adjust. Manual is what Dr. Henson and I choose primarily. In my world, it seems to get people better quicker. So basically, that's what we choose. We are trained in what's also called activator. It's a thing that looks like this. That looks kind of funny, doesn't it? But it's basically, you'd be laying on your stomach, and if some people are apprehensive of the manual adjustment, or they've had this technique before and liked it, or let's say they have decreased bone quality, osteoporosis, or babies, this works very effectively. It's basically a controlled impulse that we identify the segment and we're able to kind of use it to adjust. Now, I guess I'm adjusting the middle of my hand, but when you're on spinal segments, it's a little more important. So if you want to feel what this looks like, we'll have this up here. It's in something like this. Let's say I'm adjusting a 6-month-old baby, which if I know people say, ooh, you adjust babies. It's definitely a very safe procedure. I'll take the mom's hand and let them feel it. This is what it's going to feel like. And in babies, for example, their spines are cartilage. They don't need much to move things. So this is a technique that we do use. Primarily, we're a little bit more hands-on. I just, in my experience, like I said, I feel like it gets people better quicker. So I have some pictures. Oh yeah, and I'll get to the extremity once we're. So this is a picture of a side posture. So this obviously is chiropractor performing an adjustment on a patient that's laying on their side. I know this looks like some kind of funny position. This adjustment is probably one of the more, I've had people crawl into the clinic. We do some manual release on their lower back. We get them comfortable, and if they're in acute pain, I'm not going to adjust through pain, but you get them right where you need to be, and you have that high velocity, low amplitude thrust, and they stand up like this and go, oh, okay, see you tomorrow, you know, like there. And it's usually a steady, but you know, there's a lot of explanation that goes into this. I just don't throw somebody on their side and say, okay, now I'm going to adjust you. We explain everything, but this is what a side posture adjustment looks like. And when you come see the chiropractor, if you have a knee problem, we're going to put our hands on your knee. Like we want to move joints and figure out what's going on. So that's an example of a low back adjustment. And there are other ways to adjust low back. This is one way. This is kind of a release on a cervical spine. If we were going to adjust the cervical spine, typically I would have the head supported here, so that's just kind of a bad example, but it's an idea of what it would look like when we're treating someone. I use a technique where we kind of release some of the posterior cervical muscles here, especially up in here for headaches, before we adjust. This is, if you're laying on your stomach, a kind of a thoracic spine between the shoulder blades adjustment. So it just gives you an idea of what it looks like. We do a very good job of explaining, okay, this is what we're going to do, this is what your pelvis looks like, this is how we're going to get after it. And another activator. So besides adjusting, we have other tools. And before I get into that, you know, we always think that we just adjust spines. Shoulder, elbow, wrist are joints. Hip, knee, ankle are joints. So Dr. Henson and I both get into extremity adjusting. This is a tool that we can use. I use it more for feet and shoulder, but it's basically, we would, if it was a shoulder, you kind of slide it under the shoulder of the patient, and it provides an impulse so that we can help adjust extremities. So it's a little board that we call a Thule board for adjusting extremities. But simply, we could show you how to use this, but a lot of times people think, well, how, if I have a wrist problem, you adjust spines. No, what we would probably do, if let's say it's a carpal tunnel, we would look into lower neck, shoulder, elbow, wrist, and probably look at adjusting them all. Because the nerves start there and they travel down into your wrist. And not saying that we cure all carpal tunnels, but it's something that we can definitely help with. So, but this is what we use to adjust extremity. So besides adjusting, you know, we have ancillary therapies that help us get people better. So E-stim is a classic one. If you've never had it, you put little pads on your back. It kind of preps us on the muscles, kind of preps the muscles, kind of loosens them up before the adjustment. I have patients that call it the electric jacuzzi. So it's kind of this prickly sensation, but it has a rhythm to it, and it's very relaxing. And plus, people are forced to lay for 10 minutes in complete quiet. So I think maybe that's more therapeutic than just the therapy itself. Cold laser is something that Dr. Henson's bringing. It's relatively newer. Overuse for injuries, shoulders, wrists, fractures. This obviously uses an electrical stim to kind of stimulate soft tissue. Cold laser is a form of light that stimulates soft tissue. It's different ways. In our world, we try to get rid of the cause, but it's the muscles that usually are the thing that kind of prolong the recovery. So these are ways of getting those soft tissues to heal quicker. Flexion distraction is a table that, for people with symptomatic low back disc problems, disc bulge, disc herniation, it's a little more specific, but it's basically a table that people would be laying on their stomach. I'd be applying a force up their spine while their feet kind of drop towards the floor, and it's a repetitive stretching of the lower back to release some tension. And not only you can stretch just for stretching of the lower back, because sometimes lower back is hard to get at, but for symptomatic disc patients. We do a lot of this. So if you come in and you're a runner and you have pelvis is all out of whack, we get your pelvis back to where it's supposed to be, and we start talking about IT bands and glute muscles, and a lot of the stuff that we treat is due to muscular imbalance. You know, you have one muscle that's firing too much and one that's shut off. That creates asymmetry, and then your spine responds. So this is something that I think we're going to get with PT is going to be a huge advantage. a lot of the stuff that we get people out of pain, I want to send them to PT for 2-3 visits and say, hey, get after this stuff even more aggressively than we do and really get people better in combined worlds. So this is the part that I think we're going to work with PT really closely on. All right. Am I up yet, or are you done?
I got one more.
Oh, that's me. Okay. We went through this, promise. So benefits of chiropractic care. When you affect the nervous system and you try to get rid of inflammation, obviously you're going to get people better. You can go into reading. It's basically we're restoring function so that the body can heal. And I think one thing we underestimate is the ability to heal. The body can heal things, and we're one way of tapping into allowing the body to do what it's supposed to do, and that's why we focus on structure. Promotes healing, reduces effects of stress. We can get into what happens when we adjust. I mean, there's two sides of the nervous system. There's a sympathetic side. I'm going to get too dorky here, but that's the stressed out side. You see a bear and you're supposed to run away. When we have subluxation and we have inflammation and tight muscles, we have that sympathetic response. It's not where you want to be. When we adjust a segment, we tap into the parasympathetic response. It's the I'm at home on Thanksgiving eating turkey side. It's enkephalin endorphin release. And that's why a lot of times when people get adjusted, they kind of leave with this sensation. That's tapping into that parasympathetic response. That's a beautiful thing. People walk out and they're, I feel great. Well, we're tapping into that, your natural body painkiller, especially enkephalin endorphin release. So that's how that all happens there. So now I'll give you the documents. There we go.
So we really can help out with a number of things just because of how much innervation goes through the spine. But kind of going through each level of the spine, even tapping in the extremities a little bit. It comes to the cervical spine, certainly neck pain. Headaches are one that we do beautifully with, trying to restore normal function to the upper cervical spine. More importantly, too, getting a release of some of the musculature that can be putting chronic tension onto the suboccipital nerves, a lot of the nerves that come out from the neck. That's kind of our bread and butter. I love seeing patients that are a little bit tougher cases, especially having more chronic type of headaches and migraines, neck pain. What most people don't realize is we do definitely work on vertigo and dizziness too. A lot of people, because of repetitive stress, whiplash type postures to the neck, can have what's called cervicogenic vertigo. Vertigo that's induced by dysfunction of the normal cervical anatomy and normal tissues. By restoring, again, normal function and structure to those anatomical tissues, a lot of people, that clears up pretty well. There may be some other things that you have to do with them on a rehabilitative side, but it's one thing that we definitely, a couple of things that we definitely help out really well with. When it comes down to the mid-back, tension between the shoulder blades, that's pretty straightforward. Again, like Dr. Judkins has said, we spend way too much time in flexion and sitting throughout the day, working desk jobs, and that really over time restricts normal motion of the upper back. Significance of that too is because our extremities, upper extremities, kind of trail off of the mid to upper back. That's the origin for movement of those structures, and so if you're limited with movement of those of that upper back, you're really going to be kind of wearing the shoulder girdle out over time, and again promoting those improper movement patterns and a lot of dysfunction from there. A good example, I work with a lot of athletics, like my baseball pitchers. That's kind of classic. If they got bad posture and for years they've been on their cell phones or electronics, sitting in class. When it comes to having to go and pitch, they hit bone on bone when they're going to extend, and like I said, that eventually starts wearing out the shoulder, and that can kind of carry over into a lot of things we do. I'm just using sports as an example. But over time, that's why you see a lot of people with rotator cuff injuries getting to later on in life and tearing your supraspinatus and wearing the shoulder out, when really, if you restore some of that function right between the shoulder blades, normal motion kind of ensues in the rest of the tissues. Getting down to low back, chronic low back pain is pretty classic for us. Sciatica and disc bulges or herniations. Again, because we spend way too much time sitting, and with a lot of people, improper movement patterns, bending, sitting down in a chair. We're never really taught from an early age how to properly squat and sit down, and over time, you can only go through so many flexion motions incorrectly before those discs start to kind of wear out. If you kind of think of your spine is a couple of blocks set right on top of, like a water balloon. The minute you go and tilt one of those blocks, what happens to that water balloon? It's going to want to push out a little bit. It's going to want to bulge out. We can have those bulges sitting in our spine at any given moment and be asymptomatic, not even know that we have that going on. And it's when, we just go through enough of those movement patterns, enough of those flexion episodes that go and shave your legs and, your disc just gave out, or it turns more into an acute sprain at that point. So that's something that we definitely do beautifully with, and of course, once we get that person restored to normal function and out of pain, we address a lot of those movement issues, stretches, things like that they should be doing on a daily basis to counteract those things that they're doing every day. Then, of course, getting down to extremities, carpal tunnel, that's a real important one that we do a lot of work with. Again, we kind of start up in the neck and, of course, all the way down the arm as far as where we're looking for dysfunction. With a lot of people, they actually have what's called double crush syndrome, where they've gotten occlusion not only down at the forearm and wrist structures from the musculature and inflammation, but also from the brachial plexus structures up into the neck, collarbone, and who knows what kind of injury they may have had. You see it pretty classically with like whiplash patients who will all of a sudden develop carpal tunnel, but they maybe don't have too much repetitive stress job with the wrist. They get occlusion more up in here, and by restoring normal function of those tissues, a lot of times can help fix those issues down in the extremities. As I kind of touched on with the thoracic spine, rotator cuffs usually respond really well with adjustments to the upper back, mid-back area. Elbow pain, when it comes to the normal functioning of the knees, hips, and ankles, we are gravity-driven organisms, so a lot of times we start with the pelvis as far as our evaluation and adjusting, but if we're not getting good results with that, well, a lot of times we'll jump down to the knees, ankles, see what kind of dabble a little bit more into the patient's history, see some of the stuff they had going on, because who knows, maybe there's some issues with foot posture or movement of the ankle with dorsiflexion that we need to help restore to ultimately get proper movement up into the hips and pelvis. That's why a lot of times you see all those companies advertising shoe inserts as helping out low back pain because, again, we are gravity driven, and by correcting some of those structural deficits, it helps overall function. And again, we're kind of, helping facilitate the body's natural healing response by, fixing dysfunction. A lot of our practice, especially if we aren't getting real good results on the adjustment side, is addressing the patient's lifestyle, digging a little bit more into the habitual and nutritional and exercise things we're doing on a daily basis that can kind of cause inflammation, repetitive stress, and essentially dysfunction. So, some common questions. Does it hurt? That's kind of an individual patient thing. Each person's perception of pain is a little bit different. Person A could have the same thing going on as person B, but maybe they're a little more sensitive to inflammation, and so they may have a little more pain. When it comes to adjusting our patients, you definitely feel better. It's kind of a matter of, do you have some soreness after the adjustment, and how acute are you when you're first coming in? One common thing to have, just like if you get a good massage or you've gone and worked out when you haven't worked a certain muscle group in a while, is having some soreness associated with it. You got some tissues that with a lot of people, especially if you've gone later on in life and never been manipulated or adjusted before, those things have kind of set in. Your muscles and tissues are used to being a certain way, and we're going to go and put them back into what's quote-unquote normal. Your body isn't quite ready for that, and so it wants to somewhat take you back to what you've been used to, and we're trying to retrain that essentially. So there is a little bit of a component of soreness usually after our adjustments. Some people feel great and they walk out and they said, I didn't have one bit of soreness. But that is kind of something that we definitely let our patients know is a possible side effect of the few side effects that you can have from being adjusted. What is the noise of the cracking sound? Well, essentially, with a lot of joints in your body, there's a negative pressure within the joint, and when we go to adjust you, we take that joint to the end range motion that it can kind of be taken to anatomically, and we give that high velocity, low amplitude thrust. It pulls all of the gases that are within the solution, the aqueous solution in your joint, and makes kind of a bubble within the joint. So essentially for about half an hour, 20 minutes after that adjustment, your joint's kind of riding on a little bit of air, and it takes that amount of time for that air to kind of diffuse back into the aqueous solution and kind of return back to normal. So that's what you kind of hear when that bubble is formed is essentially that cracking sound. Now on some of the tissues, your ligaments can kind of be making a little bit of a snapping sound. That might be part of it. But a good example is if you've got a wet glass and you set it on a countertop, you go and lift it up, what usually happens is it makes kind of that popping sound. That's kind of what happens essentially when we give the adjustment. Now you don't always have to have that cracking noise to make an adjustment to the spine or the joints of the body. A lot of our techniques, they use instruments like this. They're a little bit more low force in nature. And generally with those, you won't see a whole lot of an audible with the adjustment. Doesn't mean that it didn't go back into place, doesn't mean that we didn't make a change. Especially if patients are having a lot of chronic muscular tension. You're going to be fighting through some tight muscles, and you're not going to get as effective of that negative pressure created, and thus a real loud audible. So again, you still can make effective changes, but not have a loud noise with it. Is it safe for pregnant women and babies? Absolutely. Kids are great patients because they don't have all these structural, repetitive things that have been generated through your life and chronic injuries that we've sustained. So they respond really quickly. And some common things that we see with kids are, colic. It doesn't mean that we, really correct all colic, but these are some things that we've seen in practice that generally kind of respond well to chiropractic care. If they don't respond well, then we start looking at other things, working with other providers to figure out, get down to the nitty-gritty of what's going on. Ear infections are usually something that do pretty well with chiropractic adjustments because of its correlation with the nerves in the cervical spine. General irritability, sometimes people bring kids in for, so a lot of things that we can treat kids for, and like I said, they respond really, really good. Pregnant women, absolutely. There's a specialty in chiropractic that deals primarily with all pregnancy care, and that it responds really, really well. Now, as you kind of saw before with the table that we had the side posture lumbar adjustment on, we've got these great tables that can be manipulated to change their normal posture so that pregnant women can lay actually face down for the short amount of time that we need to do correction on their spine. It's really great for them, especially when you get into the later trimesters, because they're not able to ever get in that position. It's kind of like this relief. As pregnancy is going along, there's a lot of changes to your skeletal system, and so again, your body kind of compensates, and you not only get uncomfortable, but you get pain, you get tendonitis, a lot of things that can kind of go wrong, and we just want to make sure that the skeleton and the structural tissues are functioning as well as they can, so that muscularly everything is nice and loose, and you don't have nerve irritation when you're going into childbirth. You want that process to be as relaxing as possible so that your body naturally isn't already fighting tension that's existing there. So I think that's where Dr. Judkins is picking up here.
Another common question is, well, how long is this going to take? And that $1 million question, I think Dr. Henslin and I, typically in a 2 to 3 week treatment plan, we have a pretty good idea how you're doing. That might mean I treat you a couple times the first week. If you respond great, I treat you in a week, and you're gone. We rehab, and out the door you go. Sometimes if it's a disc that we're dealing with and we're trying to save them from surgeries, it's a pretty aggressive treatment plan. So it depends on the patient. But what goes all into this is, the younger you are, the usually quicker you heal. That's just a simple fact. And then all that other stuff that goes into healing, If we're adjusting and doing some pretty good stuff there, but we're slamming Big Macs all day, that's probably not gonna help me out, So, or just general activity. We restore motion to the spine if we wanna just simplify it. If we adjust and we plop on the couch all day, that's not gonna help us out either. So, a lot of that goes into this, but this is something that, it's hard to tell, but usually we base our treatment plan on how you're responding. So if you come in with a 5 out of 10 pain and after 2-3 weeks we're not changing anything, it's either further imaging, referral, something's not right. Something's holding you back from healing. So we're pretty results based. If the body creates pain, it should get rid of pain. And that's kind of our philosophy. This is another one, manipulations and stroke is something that, you can't adjust my neck because I'm gonna have a stroke. Dr. Henslin has some statistics if you want to see straight to statistics. It is one of the safest treatments you can have. Anytime anybody has any problems with the vasculature going from their neck up into their head, a thrombus, a plaque, any kind of rotation, lateral flexion puts stress on those, it could cause a stroke. Those same people, if they check their blind spot, get their hair washed at the salon, they could have a stroke. So the manipulation itself does not cause a stroke. It's something we test for. There's a test that we do where we hold people's head in extension and full rotation and watch their eyes, but it's something we test for. But as far as it causing a stroke, it's unfounded. And it's actually, I think they've compared it like, there's 3 times more risk getting, having an injury canoeing compared to getting your neck adjusted. So I never knew canoeing was actually that risky, but that's the numbers behind it. All right, so then we'll end, and it looks like we have some time for questions, but you can read this. I don't know if you can read it, but it says, "Man, my back is killing me. Do you boys mind?" And then kids start jumping on his back, and thanks, feels better. Sorry about jumping on your head, Dad. This just shows you, and this is a dad thing. Dads with kids, like they have back pain, and it's like they kind of know something's not right, and they don't even really know why, but let's jump on it and move some stuff and see if it helps. And I hear it all the time, and hopefully they don't jump on their neck, but yeah, and then somehow they feel better. But I don't suggest this. This usually means let us figure out what needs to be wrong, but it's kind of funny. And then chiropractic, please let it to the professionals. This is something, especially with the neck, you probably see the people that grab their head and spin. It's a bad idea. I was sitting in church and the gentleman in front of me gave himself, now it's so non-specific and you don't want to move segments that you're not supposed to move. And I think my wife put her hand on my knee, like don't, educate him about chiropractic. This is freaking me out, so don't do that. And I actually saw a case when I was up in Appleton. We restore function to joints that need to be moved. Now, if you decide to move segments all the time, it's going to become hypermobile, sloppy, and arthritis will set in. So I saw a 38-year-old guy, took x-rays, the middle of his neck looked horrible. And I was like, car accidents, did you fall on your head? No. And then he did this maneuver, and I was like, oh, don't do that in my office. He'd been doing that for 25 years. Dysfunction was bad, arthritis had set in. Now we could help him up with where he needed the adjustments, kind of upper and lower, but it was already kind of too late. So they do that. Don't have them do that. So, questions? Fire away. Go ahead.
Like between the two of you, how do we know who to go to? I mean, does one specialize in something more so? My husband has knee pain.
Okay, my practice was more family practice. We both do extremities. I would say if Dr. Henslin is probably a little bit more into extremities than I am, so if it's a straight knee thing, I would say maybe Dr. Henslin would be the way to go. I do extremities as well. As far as if you're just calling in, I think we're going to develop a relationship where if I treated your husband and I think he is better off with Dr. Henslin, I'll get him right around the hall to him. So, but the good thing about us two is that we practice pretty similarly. Like our philosophy is the way we adjust. So if you come see me and we have success and I decide to take a day off, you go see Dr. Henslin, you're not going to have much difference. And in our profession, there are a lot of different techniques, and sometimes you can go see one person and go to somebody else and have a completely different technique that you have no idea what it's about. But us, we're pretty similar. So as far as which way to go, I would just flip a coin and then we'll get him where you need to be. So you want to take the next one? We'll alternate.
Is sciatic, is that a chronic condition, and can that be helped by long-term chiropractic care?
Absolutely. What sciatica usually coincides with are lower disc issues, and so with that, you got some soft tissue changes because anytime you have irritation around the disc, obviously you're affecting some of the nerves that go around to those localized tissues, and usually too with lower pelvic stuff, you've got compensation of the pelvis itself and piriformis muscles, which run really close in proximity to where your sciatic nerve goes down your leg. So by correcting that stuff, a lot of times sciatica will clear up. Especially too because there are different referral patterns of the joints themselves as far as pain goes. So what people may know is true sciatica could actually be more SI related issues that are giving a little bit of a radicular pattern, but not true sciatica. So here to answer your question, yes, it can definitely help out with that. Again, it's kind of our bread and butter. A lot of that has to do with then, once we restore some of that normal function, giving you proper stretches that you need to be doing kind of on a daily basis or regular basis to keep that there, and keep yourself from re-aggravating those tissues.
But as far as sciatica, sciatica truly means that the person probably has some sort of leg pain with their back pain. So the sciatic, when people say, oh, well, everybody's got sciatica, my leg hurts. Well, Sciatic means irritation of the sciatic nerve. Is that caused by subluxation? Is that caused by disc? Is that caused by muscle? And that's kind of what we figure out. And it's caused by more than one thing, but yeah, the sciatic nerve is created from multiple branches from the lower back and then combined right in the middle of your butt cheek to create the sciatic nerve. So if it's butt cheek related pain, yeah, it's sciatic pain, but what's causing it? And that's why we kind of get after that.
Thank you.
If an elderly person has a complete rotator cuff separation and they cannot have surgery, and they cannot lay on their stomach, can you help that person?
That's an interesting question. It sounds, I'm guessing, well, since it's, you said dislocated?
Well, it's not dislocated,
Okay.
it's just like.
They can't do surgery on it.
Because she's elderly. And
Okay, that would be something that, yeah, we would look into lower neck, because that travels into shoulder. And I'm guessing her, the rotator cuff muscles are all out of whack. So it'd be a lot of soft tissue release, getting after, and then looking into the neck and mid-back. Dr. Henson talked about how all the muscles that travel into the shoulder connect to mid-back. So let's release mid-back, lower neck, get after, soft tissue release in shoulder. And that's something where, yeah, if we focus on spine part of it, and if it's a lot of soft tissue dysfunction, because if it's that bad for that long, there's a ton of soft tissue problems, coordinate with PT. And I think that's where you're combining worlds of trying to get them out of pain as much as possible, so then they can rehab better. So yeah, that's definitely something, especially if surgery is not an option. There's not many options left.
They have to
So.
lay on their stomach.
No, we could get around that. That complicates things, but yeah, there are people that can't lay on their stomach. There are a lot of stuff we'd like to do with people laying on their stomach, but if they can't do it, can we work on a shoulder while they're sitting? Yeah.
Thank you.
So when should someone see a chiropractor?